My name is Melissa Prunty. I'm the Divisional Lead for Occupational Therapy at Brunel University, London. I'm going to talk to you about our BSc Occupational Therapy programme. It's a 3-year programme, full-time, and students will learn about occupational therapy through 4 different curricular pathways. The first one is around professionalism and the developing occupational therapist, and this is where we teach students how to be a professional, how to work with others, how to understand occupation from a community perspective. Students will spend time out in the community as part of their learning hours. They'll also work in teams. They'll hear from lots of different professionals about how multi-professional working works in the workplace. The second thread is called enabling occupation, and this is a lot of the doing of occupational therapy. So we use a lifespan approach. It has 5 different modules. We start with the older adult, then we do working age, children, young people and family, working with groups and communities. And then in the final year there's a module called specialties, where students can learn and think about what they might like to do next. So we use lots of practical skills. We do lots of simulation of aging and the aging process. We also look at things like hand therapy and the use of sport and physical activity in the working age adult, but also in children, young people and families. We do a lot of creative occupations like art, cooking, dance. And then in the final year, students can really think about the areas that are of interest to them. So it may be intensive care, it may be stroke rehabilitation, it may be working with the homeless. These are things that we cover in the final year of the programme. Our students will do 3 placements that are outside of the university. They'll do 1 that's inside the university. The first one involves simulation. So we have a ward here where students will work with people from the community to get their skills up to speed before they go out into the clinical world on their 3 practice placements. The final thread in the curriculum is research and evidence-based practice. Brunel is a research-intensive university, and so we expect our students to be able to read and interpret research and literature. One of the best tools you can have as an occupational therapist is your ability to understand research, because when you work for 30, 35 years, things will change, but your ability to read what's changing, to understand it and to apply it are really paramount. Our team is big. We have a big team of 20 academics from all over the world. You'll hear lots of different accents, but you'll also hear accents in the classroom because our students tend to be from all over the world as well. So we're very proud of that. We're very diverse, and it's one of the strengths of our OT division here.